Hey everyone, today I want to talk about and address abdominal separation, aka diastasis recti, and why surgery really is not a great option. I know it can be sold as a great option by many doctors and surgeons, right? That's what they do. And not for lack of another option, it's because they don't really understand or know another way. Hey, I'm Erica Zeal, creator behind the Core Rehab program and Nocta Fitness, and my specialty really is teaching you how to properly strengthen your deep core, whether it's during pregnancy, pre-pregnancy, postpartum, or beyond. And it really is never too late to work to strengthen your core appropriately, like you should, or like you could, I should say. So when it comes to surgery, with especially, let's specifically addressing abdominal separation, which is where you get the separation of the abdominal wall, which happens for many during pregnancy. But to know that what surgery actually does is when you cut into the body, what happens is when it heals, you end up with a bunch of scar tissue. And so that scar tissue becomes what I like to say, kind of like junked up fascia, like the connective tissue in our body, which the cool thing about fascia is that we can create more of it and we can create better fascial striations through our body, which goes to tell you that with abdominal separation, even though you have the separation, knowing that we can actually go in and create new connective tissue, new fascia, and better functioning fascia. So that's exactly what I teach you in my programs, and it can sometimes, the simplest little movements can make such a big difference for how your core connects. So when we have surgery, we're left with scar tissue, and this goes with any scar tissue in the body anywhere, but specifically addressing with the abdomen is when you have surgery and you're left with scar tissue afterwards, around the scar tissue you get like this mangled up fascia, connective tissue. And so what can happen with that is then that can get really, really tight, and so the fascia, the connective tissue that's on the outside of where that scar tissue can be weak. And so then as time goes, that's where we can actually start to run into other issues that were caused by the surgery. So unless we're really working to create better fascia, better blood flow to the area, surgery really is only a band-aid solution. It's not actually re-strengthening anything. We can't re-strengthen anything. Surgery just pieces it together, but then again we're still left with weak connections from our pelvic floor through our deep core, and again we have to incorporate posture, we have to incorporate how our pelvic floor and deep core is actually functioning, because again a lot of times, especially if you feel like maybe you're way beyond having babies and you still feel like there's those days where you just still look like you have a belly, and some of it's from digestion, some of it's from stretched out and weak fascia and connective tissue. And so we can do so much through improving digestion, improving pelvic floor and deep core connection and strength, and also improving the fascia, the connective tissue throughout our entire body, and of course especially through the abdominal wall. So that's one big thing when I get a lot of response sometimes, like some women will say, and it's purely just because they don't know, because OBs and other physicians are not addressing this with their moms. We're really not talking about it in the medical community. But I really try my absolute hardest staying up on the latest and greatest research around the core and around fascia, and it is absolutely amazing in what you can do. And I've seen so many women, I've worked with so many women who are continually improving not only their abdominal separation, but their pelvic floor function, their entire body. It's amazing what the simplest little things and how it can really, really impact the quality of your life. So remember that surgery sometimes it is absolutely necessary for certain things, but when we're specifically addressing just the abdominal separation down the front of the abdominal wall, we really have to work from a deeper layer to strengthen and start to bring everything together. And again, when we're talking abdominal separation, it's more important that we create better fascial connection through the abdominal wall and not get so concerned with how much space, right? We of course want to bring it together to as close as we can, but knowing that having a tiny little space down the middle is normal anyway. But what we want, even with little space, you can still feel that you might have depth in the abdominal wall when you check for abdominal separation. So if you feel that still is a sign of weak tissue, weak fascial connection through the abdominal wall. It's something that we can work to strengthen. So anyway, I could go on all day talking about that, but we'll be talking about so much more. I'm trying to answer so many questions revolving around core function, because so many things in our body really revolve around our core. And when I'm talking core, remember, it's from your pelvic floor to your shoulders. Also addressing, pelvic floor function, specifically how it's functioning, because that's where a lot of this starts. It's important to have the strength in the hamstrings and the glutes. So anyway, if you have any questions, please ask, but know that there is so much that you can do, and surgery is something that you do not need at all for abdominal separation. One last little thing I want to talk about, and I want to do a whole nother talk on this, but the really cool thing, because I have worked with many women that have had C-sections and they want to know, okay, what's core rehab for them? Absolutely. But the cool thing is with the incision, you can really see this, because people that I work with diastasis haven't had surgery, right? I'm working with it before and we're fixing it, and it's amazing. But with C-sections, when I have a mom that's come to me and they've had C-section, especially, and no matter how long it's really been, it's really pretty cool, because when we start to wake up the core and stimulate more fascia and more blood flow through the abdominal wall, you actually see their incision start to pink up. It's like we're bringing life back into where she's had surgery. So even if you've had a C-section, don't worry, you can improve. And a lot of women will talk about, oh, I can't feel anything there, and that's normal, because the blood flow, we gotta wake it up. We gotta create better connections so you can feel amazing, you can feel good, because we don't, as a mom, it's hard enough, right, keeping up with everything. So know that I am here for you. There's so much that you can do, and if you have any questions, please just ask. If you're ready to dive in, start and re-strengthen your core the correct way, even if you haven't had little ones yet, but most of you watching this already have. Check out corerehabprogram.com, and I'll see you guys soon.